Welcome to CONy Congress in Madrid in 2019. My name is Grinberg. I'm a neuropathologist, associate professor of neurology and pathology at the University of California in San Francisco, and it's my great pleasure to be the head of neuropathology in CONy for many years. CONy brings a very innovative way for a Congress because instead of having the traditional way in which a speaker will come and just talk about a theme without really room for looking at the other side of the problem, CONy brings debates. In each debate, we have two speakers, someone who will defend the question and someone who will be against that concept. And then an expert moderator will help the audience to ask questions and to really examine the problem in depth. Because of CONy concept of bringing debates, it's easy to translate the result of the debate to the clinical practice, where we have day-to-day to make decisions based on the patient, on the case, and sometimes it's difficult to navigate what is new in the area, what is fake news in the area, and CONy really help us to make these decisions. Here at the CONy, I lead the session on neuropathology. So you might ask yourself, why neuropathology in a neurology conference that is targeted to clinicians? Well, my answer is that we try to incorporate neuropathological latest advances in all clinical sessions. Not only we want to put in a debate why we use this treatment or that treatment, but also we feel it's important for everybody to have some understanding of the neurobiological basis of that condition or that disease. For instance, in the field of dementia, in Alzheimer's disease more precisely, the current diagnosis is based on biomarkers and not anymore in the clinical manifestation. So once again, it might be difficult to try to navigate in all these innovations without a situation like a debate. One of the debates that we have is it useful to do the diagnosis based on biomarkers? It will help patients and families or not? So everybody can decide based on the most up-to-date knowledge. Another value that CONy provides to participants is the fact that we have people coming from all over the world. This year we have participants coming from 85 countries. CONy promotes many networking opportunities. Lunch is served on site as well as snacks, and the faculty is always available for questions and discussions. So at CONy we can have the perspective of people from all over the world, and this, I think, really brings perspective to our clinical practice. I attend many conferences throughout the year, but CONy is the one I enjoy the most because of the debates. Even for me, a neuropathologist, I'm always exposed to very provocative questions in CONy, and I end up always seeing a theme in a way that I couldn't see before, because when I read a paper, the author is trying to give me his or her perspective without really discussing other people's perspective. And this is one of the reasons that I come back to CONy year after year. Another thing I really appreciate at CONy is that how it refreshes itself every year. Throughout the year, the head of all sessions work together to bring the most provocative and up-to-date themes for discussion. What we bring this year is different than we brought last year and the year before. So every year we learn something new at CONy, and this is something I really appreciate. And this is why I'm here this year, and I was here last year and the year before, and I will be in London in 2020, and I hope you all join me for fruitful discussions and networking.